Proposition 29 requires on-site licensed medical professional at kidney dialysis clinics and establishes other state requirements. This is an initiative statute, so this was put on the ballot. Enough people signed petitions, and so this is why we're voting on it. A yes vote means that chronic dialysis clinics would be required to have a physician, nurse practitioner, or physician assistant on site during patient treatment hours. It would also include a number of additional reporting requirements that I'll describe. A no vote means that the current staffing requirements at chronic dialysis clinics would not change, and the current reporting requirements would not change either. So I have to give a little bit of background on here. I know that there are some older people listening to this. A shout out to the people at Belcaro that know what dialysis is, and but I have to go over this because some of my students, my younger students, don't know what it is, and so bear with me. For my younger students, this is what dialysis is. You might want to talk to your grandparents, or they might know something about this. Dialysis removes blood from the body. It filters it through a machine to remove waste and extra fluid and then returns it to the body. People need dialysis when their kidneys are no longer functioning. So they either have the option of going on dialysis or getting a kidney transplant. So a single dialysis treatment lasts about 4 hours and happens about 3 times per week. So it's an extensive process. Clinics oftentimes offer treatments 6 days per week and are often open outside typical business operating hours to allow for the length of the treatment that it takes. Physicians, doctors, design the dialysis treatment plans for their patients, and then technicians at the clinics carry out the treatment plans, but they're established by the patient's physicians. Federal law requires the physician to visit a patient during a dialysis treatment at least once per month. So their doctor, whoever's come up with a treatment plan, has to go to the clinic at least one time per month while the patient is being treated. The Legislative Analyst's Office estimates that clinics have a total revenue of about $3.5 billion each year annually from their operations in California. Now, a variety of people pay for dialysis. The payers include Medicare, Medi-Cal, and then there are group health insurance and individual health insurance that also are payers when somebody is on dialysis. California relies primarily on federal regulations as the basis for its licensing program. So when it licenses clinics, it basically uses the guidelines provided by the federal government. Federal regulations do not require medical directors to spend a set amount of time at a clinic. There is a medical director, but they don't have to spend X number of hours at these clinics. Now, to receive payments from Medicare, clinics have to report specific dialysis-related infection information to the CDC. So if there are problems that do happen periodically, that information has to be reported to the CDC. What Proposition 29 would do is it would require clinics to have at their own expense at least one physician, nurse practitioner, or physician assistant on site during all hours that patients are receiving treatments. It requires clinics to report dialysis-related infection information to the California Department of Public Health, every 3 months, and the information has to be made public on the department's website. It also requires clinics to give patients a list of all the physicians who own at least 5% of the clinic. And finally, it requires clinics to report to the California Department of Health every 3 months persons who own at least 5% of the clinic. Now, the fiscal effect, if Proposition 29 passes, according to the legislative analysts, would be that it would essentially increase costs for the clinics by virtue of having to have somebody on staff at all times, it would increase their costs. The owners and operators might try to deal with that a variety of ways. One thing they might do is the owners and operators might try to negotiate higher rates from the payers of the dialysis treatments. They may just accept the reduction in profits. In other words, they may say, well, look, we're just going to make less money, but we're doing fine. Or, according to the legislative analysts, they might seek to close less profitable clinics because in some cases, companies own multiple clinics, some of which are profitable, some of which are not as profitable. So in theory, they could seek to close down less profitable clinics. However, they would need to get approval from the California Department of Public Health to do that. They could also, it could also have the effect of increasing state Medi-Cal costs and cost for state, local employee and retiree health insurance costs. So if the cost of treatments goes up, then the state may have to pay more money in order to assure that people are covered. The new regulatory responsibilities of the California Department of Public Health established by Proposition 29 would have an annual cost that would be likely not to exceed the low millions of dollars annually, so that wouldn't be the big fiscal impact. The argument in favor of Proposition 29. The lives of dialysis patients are dependent on treatments being done safely and effectively. What Proposition 29 does is it makes common sense improvements to dialysis treatment and to provide some of the most provide these protections to some of the most medically vulnerable citizens. It requires a physician, a nurse practitioner, or a physician's assistant to be in the clinic whenever patients are being treated. And it also increases the reporting requirements to the state. As I said, the federal government already gets some of this information. It requires dialysis corporations to get approval from the state before closing clinics or before reducing salaries. And it increases transparency and helps patients make informed decisions for their care by requiring clinics to disclose information about ownership, the physicians that are part owners of the clinics to which they're getting their treatments. Proposition 29 will not create huge costs or harm patients or create a shortage of doctors. Corporations, proponents argue, can easily make the changes required in Proposition 29 and still profit hundreds of millions of dollars a year without disrupting our healthcare system. The argument in opposition to Proposition 29. They argue that Proposition 29 is going to force dialysis clinics to have new administrators on site at all times, even though they don't provide direct patient care. They argue this is unnecessary. This unnecessary requirement would cost hundreds of millions every year, forcing dialysis clinics to either cut back on services or to shut down. California's dialysis clinics are already regulated by federal and state agencies and have high ratings for quality care and patient satisfaction. Dialysis treatments are administered by specially trained nurses and licensed technicians. This is the third time, they argue, that special interests have placed dialysis measures on the ballot, and California voters are overwhelmingly rejected them on 2 previous occasions. The measure has a number of needless provisions, such as requiring infections to be reported to the state, even though those data are already being reported to the federal government. No other state requires a doctor on site, nor do the Centers for Medicare and Medicaid Services or the California State Department of Public Health, which regulates dialysis centers, nor is there any evidence that the current arrangement has harmed patients. So, a yes vote means that these chronic dialysis clinics would be required to have a physician, a nurse practitioner, or a physician assistant on site during patient treatment hours. A yes vote would also increase a number of the reporting requirements, especially as they relate to problems within the clinics like infection rates as well as ownership requirements, reporting requirements. A no vote means that the current staffing requirements at the chronic dialysis clinics would stay the same and the current reporting requirements would not change. In this case, I've highlighted Proposition 29, the California Republican Party recommends a no vote. The California Democratic Party recommends a yes vote. The California Chamber of Commerce recommends a no vote. The California Labor Federation recommends a yes vote. And both the Los Angeles Times, which tends to have a more liberal stand, and the Los Angeles Daily News, which tends to have a more conservative stand, both recommend a no vote on Proposition 29.